Hi, I'm Dr. Krupka, and today we're going to talk about adrenal dysfunction. This is number 2 in our 3-video series on adrenals. We've already done adrenal physiology. Next, we're going to do 10 tips for healthy adrenals. So let's start with adrenal dysfunction. As we mentioned in the last video, when you have dysfunctional adrenals, there are a whole host of issues you can have, ranging from digestive issues, allergies, chronic fatigue symptoms, symptoms of hypothyroidism. Technically, this would be secondary hypothyroidism because it's because of something other than the thyroid, and not primary hypothyroidism, which comes from the thyroid directly. You can have immune system weaknesses, you can have a tendency toward type 2 diabetes or basic sugar handling issues, and then dysfunctional adrenals can act as a trigger, or they can exacerbate a whole multitude of other degenerative diseases or disorders. Now, within adrenal dysfunction, some patients tend to have a cortisol deficiency, others have a cortisol excess. You'll see when that happens here in just a minute. But there are certain symptoms that go along with each. So first of all, with a cortisol deficiency, you tend to have chronic weakness, weight loss, fatigue, poor stress tolerance, meaning you don't react to stress appropriately, anorexia or poor appetite. You can have alternating diarrhea and constipation. Technically, those are the cardinal symptoms of irritable bowel disorder. You can have salt cravings. Those are very common. Postural dizziness, meaning when you go from lying down to standing up, you can't control your blood pressure and you get woozy for a few seconds. You might get a little tunnel vision with that. Muscle and joint pain. Hyperpigmentation, meaning you get small spots that look like they're bronzing kind of spots on your skin. The hypotension or low blood pressure, and even anemia. Those are all signs that kind of fall on the cortisol deficiency or lack of cortisol side of this whole equation. Now, on the opposite side of that, you have cortisol excess. Now, with having too much cortisol, you have a tendency to have sugar cravings, central obesity, which is obesity around the trunk, that kind of beer belly appearance, insulin resistance, meaning you don't handle your blood sugar well. Understand that this can range anything from something that's mild like metabolic syndrome, syndrome X, mild insulin resistance. Those are all kind of pre-type 2 diabetes, all the way up into having formal type 2 diabetes. Weakness, shakiness between meals, irritability, easy bruising, hypertension, which is high blood pressure, amenorrhea or not having periods, impotence, oily skin, and sleep disturbances. All of those go along with cortisol excess. Now, adrenal dysfunction, the adrenal activation system, I'll call it, tends to happen in 3 predictable phases. First is the alarm phase. During the alarm phase, the adrenal stress response has been triggered. Your body is initiating that response, and it will raise both the DHEA level and the cortisol level. You'll see here in the flow chart to the right, this starts with cholesterol, not the boogeyman it's made out to be all the time. We need some cholesterol in our body. This is but one of the processes for which cholesterol is very important. So cholesterol becomes pregnenolone. Pregnenolone then has a choice. It can become DHEA or progesterone. Now, if it becomes DHEA, and this doesn't have to be an all or nothing choice, right? You kind of decide how much of your pregnenolone you're going to divvy out to either side of this. But DHEA, although I haven't shown it here, has its own flow chart of going downstream and becoming your androgens, your estrogen, testosterone, androstenedione, DHT, the androgen hormones, that side of the gender or reproductive hormone tree. Now, pregnenolone can also become progesterone, which becomes 17-hydroxyprogesterone, which then becomes cortisol. Cortisol is the end game here. As you start to initiate the stress response, you need more cortisol. At first, your body doesn't know how long this is going to last. It just cranks up the entire system. So DHEA will be either normal or elevated, but cortisol will start to get higher. That's, by definition, part of the stress response. Now, the next thing that happens is you move into the resistance phase. After the alarm phase has subsided and your body realizes, wow, this is going to go on for a little while. Now pregnenolone is shunted away from DHEA production and forced more into cortisol production. At this point, you will start to see the DHEA getting lower while the cortisol continues to either stay high or get higher. Now, this is a very important step. It seems to make sense. You need more cortisol to survive. This is a life and death situation as far as your body's concerned. But I want you to notice DHEA has the potential to go downstream and become your androgens. We already mentioned testosterone and estrogen and androstenedione and DHT. Now, this is the way your body's got a link from the adrenal glands or your stress response to your reproductive system. If your body senses that you are under a long, protracted stress response, it will start to work to shut down things like ovulation, menstruation, sperm production. None of that is important when you're running for your life. So it will shut that down and shunt those resources over toward cortisol. Now, this was not meant to last for months at a time. This was supposed to be a fairly short-acting stress response system. You get chased by a bear, you run back to your cave, everybody's happy, and you're done. Okay, they didn't have the IRS when they designed this system. So this is a way for your body to say, look, if something's really going on for a long period of time, I don't need to be reproducing, I need to be surviving. And so it starts to shut down some of those more reproductive related systems. Eventually you work into what's called the exhaustion phase. After prolonged stress, the adrenals have fatigued enough that both the DHEA and the cortisol are now low. You have run out of steam. You do not have the ability to generate a significant stress response at this point. This is adrenal exhaustion. All right, so this goes well beyond the first two phases that we saw. Now, cortisol rhythm is one of the ways we can judge kind of where you are in this whole adrenal exhaustion alarm phase, type of system. I've put 3 adrenal stress tests here on the screen, and as I describe them, it'll be obvious to you why I chose these 3. But on each of them, these are saliva tests. There are samples taken at 8 in the morning, noon, 4 in the afternoon, and midnight. Now, at each of these, you'll see there is a red line that runs across the graph and a blue line that runs across the graph. Those are the upper and lower limits of where your cortisol levels should be at any of those given times. Now, the black solid line are the patient's values. So in the first one up on top, you'll see the first patient value is well above the normal limit. The second patient value is right at the upper limit. The third one, again, is right at the upper limit, and the fourth one is actually right on top of the upper limit. It is the upper limit. So this is someone whose cortisol is globally high throughout the day. There is no major dip where it gets low enough in the cycle that they feel the way they're supposed to. This is someone who is activated most likely in the alarm phase, or possibly in the second phase, where their cortisol levels are distinctly high. Now, the next test, you'll see the patient's values are at the lower limit for the first one, when it should be as high as it is for the entire day. They actually come up into the normal range at noon. Then they're at the bottom edge for 4 p.m. and they're obliterating the bottom edge for midnight. So this is someone who is globally low. Their cortisol levels have been roughly exhausted. Now, the third test, you'll see, they probably make an average amount of cortisol or an appropriate amount of cortisol for the day as a whole, but the distribution of that cortisol is not correct. All right, so that's temporally distorted, and that needs to be changed to keep their sleeping and waking patterns appropriate. Now, low DHA is something that's worth mentioning. Sorry, DHEA is worth mentioning. It's connected to, or it influences, over 150 metabolic processes. So the effects of this can be far-reaching. But it's a powerful hormone considering what it becomes downstream, and you should not just randomly supplement that. Generally, you need to work to get the adrenals functioning appropriately and let them make their own DHEA on demand from the body. If you supplement with DHEA and their hormone machine is not geared to make the appropriate blend of hormones, you will just exacerbate whatever dysfunctional blend they're making. And then there are several ways to assess the adrenal function. We have saliva tests, which you already saw here. There are some very good adrenal questionnaires that can give you some insight into where you fall on this spectrum. And then a qualified practitioner should be able to do a good history and physical exam and get a general idea of where you are with all this and what treatment needs to be done. So as usual, I'll show you how to contact us. drkrupka.com is our website. You see the phone number and the office address there. Feel free to call or email us and ask questions. Post your questions under the video. We'll be happy to answer them. And look forward to our next video coming out, which is 10 tips for healthy adrenals. So stay safe, be healthy, and we'll see you on the next video.